Hello and namaskar, I am Sanjeev Pandya welcoming you to the another edition of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. Good health is the thing that makes you feel now this is the best time of the year. It's all about importance and benefits of Ayurveda and the Panchakarma that we discuss in this show with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA. With that note, I'd like to welcome Dr. Ambika Nair to our show. Ambika ji, namaskar and welcome to the show.
Hello Sanjeev. Namaskar. How are you all?
Very good. Today we want to know from you and of course our viewers, they have requested this, that they want to know more on sacroiliitis. What is sacroiliitis and what causes sacroiliitis?
Yeah, that subject is very good actually. Sacroiliitis, because so many people suffer with that.
Achha.
And you know, like even in my clinic also, so many, we get a lot of cases like that. And especially during this season, this pain aggravates a lot.
That's why I guess our viewers, they want to know more
because,
on sacroiliitis.
Yeah, that may be the, even you, I think you told me about the emails also.
Correct.
It's very, you know, like they won't be able to get up from the bed.
Wow.
Because they cannot even turn on the bed. Yeah, that is very disgusting.
So what does sacroiliitis mean?
Okay, you know, sacrum is our connecting bone, you know, to the pelvic bone. Okay, that is one part of the vertebrae. Okay, and our ilium is getting connected to that. So that joint become inflamed. That's all. And inflammation, the causes are very different.
Achha.
Yeah, it can be autoimmune disease. Like any, you know, people with the lupus can get it, even psoriasis can get it.
Achha.
Yeah, okay. Any autoimmune disease, it can get it like that.
Does it start like instantly or slowly pain develops and turns into sacroiliitis?
No, especially that sacral bone, you know, that is the lower part. So that area you can see that very painful and local inflammation will be there. If you touch, the other body part will not be that bad,
Achha.
but only that part will become like a very, you know, like very hot when you touch a person. Because they will always complain that ye to ubal rahe. You understand? No?
Achha.
Yeah, it will be like boiling and sometimes it will be red. Otherwise, only that part will be like a temperature, high temperature you can feel over there. Tenderness you can feel over there. Okay. So this is the first thing what they will tell. And you know, low grade fever will be there. And the fatigue will be there.
Achha.
Yeah. And some days they don't have any radiating pain.
Okay.
Otherwise, you know, like only on the back. Sometimes it radiates also a little bit. But they cannot turn. They will tell that kamar se to main move nahi kar sakta hai. Restricted movements in the sense they cannot turn on the bed. That is the first sign what they will understand.
Really?
Yeah.
So if they cannot turn in the bed, that means they can't get up and they can't walk.
They cannot, because they will be lying on the bed for a long time like that.
But why in the winter and not in any other season?
Winter, because it will be cold. Cold weather aggravates the pain. Anybody with arthritis or any issues like that, you know, you just go to the, you know, like out, you know that it will become very stiff. That's why we have to stay warm always. Yeah.
Right. Now, you know, the person who contacted us obviously watches our show.
Okay.
That person happens to be a very, very young age. Have you seen this in young people also?
Any age can happen. But I have seen even very small children also, like 11-year-old also. That was with an accident actually.
But beside that, I mean that...
No,
that
was an accident which has, you know, crushed the bone.
Okay.
And then it has, you know, like all degeneration were there.
But that's an exceptional case. So yeah, beside that case...
Yeah, like, see, young age means 90% it will come like this only. Or with, you know, some people will with chronic, any kidney issues will be there, urinary tract infection will be there. Like a chronic, okay, that even in ladies you see that chronic pelvic inflammation. These all things leads to this.
Okay.
Yeah, and it get affected to the bones, you know, like all the caries of the bones.
Okay.
Yeah.
Interesting. All right, we're going to take a break, and when we come back, we'll continue to talk on sacroiliitis. That's our topic of the day in this Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. Please don't go anywhere. Welcome back to the second half of the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. Today's topic is sacroiliitis. In the first half, Dr. Ambika Nair explained to us what is sacroiliitis. Now, having known what is sacroiliitis, let's get more information on sacroiliitis. What causes sacroiliitis?
Yeah, there are so many factors which is responsible to make this disease actually. Because in the young age, and it can be because of any trauma, and who are in sports and all, and this high jump, long jump, all these gymnastic children and all, they are really prone for all this sacroiliitis. Okay, this is the young age. The second is that according to the age, okay, like as we grow old, so this is very common, sacroiliac, because actually there will be degeneration over there of the bones. Okay. Third thing is, like abuse of drugs. So many painkillers are taken.
Oh, I see.
Okay, and so many intravenous injections, so many other, like getting treated for any other things. So the toxins, in Ayurveda we tell that all the toxins get collected in the sacral area. Okay, so that that becomes because there is no nourishment over there. This is like how the triptylutes are made. So the bones are getting all the pores, and like that degeneration happens. So this is very common in the old age people also. Okay, then like any like a SLE, lupus, all these people, psoriasis, very chronic cases. And like I have seen even in like a very chronic dermatitis, all those things, these people get this low backache. So this is sacroiliitis actually.
So what you just told us, it sounds like it's very active sacroiliitis, right?
Very, yeah.
But before it becomes very active sacroiliitis, does it go step by step? It starts with minor pain, and then
little stiffness.
So if people who are ignoring this, thinking it's just some back pain or lower back pain,
they just take painkillers.
Correct.
Actually, that's what especially our community, they will never go to the doctor. Okay, so what they will do, they will start taking all the painkillers. Okay, so like the local temperature, you can even see from their face how much they are suffering. That the face will be little very dark and tired. They always complain. Afternoon they will be better in the morning. Okay, like afternoon, like after 2 p.m., their body gives way. They cannot even have energy to stand for a long time. Yeah, and they will have anorexia. Like they won't feel like eating. Even their food habits, everything get worse.
Okay.
And once you are not feeding yourself, again your health is going down and down.
So that is the active sacroiliitis, and now you also explain the step by step when pain starts, minor pain starts, and if you ignore that pain or if you continue to take painkillers, it just develops into this active sacroiliitis. Now, having said that, is there a good cure for sacroiliitis?
Yes. We have like a very good treatments in Ayurveda, okay, so that further deterioration will not be there. Okay, whatever has happened, like it will be there, but at least they will be better with all these treatments actually.
Can it be cured through allopathy also, or it will just suppress the pain for a while?
No, they only, like suggest physical therapy, steroids. Actually, we get a lot of cases, Sanjeev, by taking cortisone injections and even like tablets, and there are so many other like how they treat anyway, I don't want to tell anything against anything, but so many painkillers, so which affects the liver most actually.
Correct. Now besides that, Ambikaji, there are no any other factors which would play a role into this. In what I mean to say is that eating habits.
Definitely eating habits will be, eating habits are also there, because sacroiliitis actually like the calcium is more needed over there, but the inflammation, like we have to find out how he got it, whether it is treating for the cause, Sanjeev. Because sacroiliitis, whether it is traumatic, means we do the treatment accordingly, what they need at that time. Okay, so whether the nutrition he is getting properly, whether he is suffering from any thyroid issues, whether he has any urinary tract infection, any genitourinary or anything like that, any other disease which is making him to suffer from sacroiliitis.
So that's a sacroiliitis, and we're going to take a break. When we come back into the third segment of this Ayurveda Mantra Show, we'll have more information on how Ayurveda can cure sacroiliitis. That's coming up right here. Please don't go anywhere. Welcome back to the third segment of the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. Viewers, this is the show where we bring you all the information and we discuss benefits of Ayurveda and the Panchkarma. So should you have any question on your health or anyone in your family's health related matter, please do send us an email, info@santigramusa.com. You'll see the email ID on the screen, info@santigramusa.com. Dr. Ambika Nair or anyone else very qualified individual at Santigram USA will definitely get back with you and get in touch with you to explain to you the remedy for your health problem. But do send us an email, info@santigramusa.com. With that note, sacroiliitis is the topic of the day. The way you described it, it even sounds like it that I don't know how a person can move around with that kind of pain.
It's very difficult. Only with a painkiller these people move around.
You have seen patients coming to your center
they come
with so much pain?
Very, like a crying whole family, because especially when it happens to the children, like a 14, 15-year-old and all, it's very touchy, I should say. And because they don't want to take any other now, because they have taken a lot of time, like since 2 years, 3 years, they were taking all these painkillers. And the general health deteriorated like anything. And they were doing physical therapy and all those things.
Okay.
Then we have like a cases now.
I surely believe that, and obviously they come to you after trying almost everything out there, and they come to Ayurveda.
Then they will tell that like now within 2 days we are not becoming better. We'll tell that in not 2 days.
Exactly.
Give me time so that I can cure you.
How do you cure sacroiliitis through Ayurveda and Panchkarma?
First of all, like I do the pulse reading. Pulse reading minutely, not only the sacral area, like observation and everything, then we see that where all this child has, the person has got the issues. Okay, then we tell, like we start with the therapies, with the diet, and snehapanams will be given, and the diet is very strict at that time. We make them to be vegetarian only at that time.
Okay.
Then they will ask, the children means they will ask, how long I have to be vegetarian? You have to be vegetarian because I have to do the detoxification. Let me remove all the toxins from your body where you got, like affected. Then, like they agree with that. We have to explain them, motivate them, counsel them. It's very important. Otherwise, they will never take these treatments. Okay, because then, like we do the Prishtivasti for these people, not only Kadibasti. Kadibasti we will give, but from here, because they will have, like sometimes they will complain of the tenderness from the whole thing, like a whole spinal cord. So that we take care in that way. Prishtivasti means we make a bun like this and we pour special oils are there. Special oils are there. Okay, then, like we give them therapeutic enema also, which will detoxify from their alimentary system, which is making the disease. The diet, very rich food we have to give them. Ghee preparations we give them, so that, then there are so many very good medications in herbal supplements in Ayurveda, what we have it, like Yograj Gulgulu. There are so many medicines,
Wow.
And Vadirasana, Sahajaradi, even, there are so many things. And
So,
Amritarishta, Amritota Kashayam.
So, a person with a very active sacroiliitis, right, comes to Santigram Kerala Ayurveda Wellness Center and the treatment starts. Normally, the average treatment is how long?
It is according to the severity, Sanjeev.
Let's say it's a very severe.
It is very severe. We tell them to, like maybe for 28 days.
Okay.
Not only this treatment, there are Nyavara too, like there are so many other treatments.
Do you combine treatment with herbal medicines also?
Definitely. In these cases, we have to give. And what they have to do at home also. Like especially for the children and all, they come in the group. So we have to educate them also. It's very nice actually. I like to do the services like that.
And then after treatment, what do they have to do?
3 months, because they will be under strict like observation. They will come even every 15th day also. Then I call them like that. Then, like as they are feeling better, then they come after like 1 month, monthly once they come. They collect the medicines. We change the diet. Not that every time they will be vegetarian. I tell them, about the very good diet, what all they can take.
Now, what about reoccurrence?
This is a very good question, Sanjeev. Really, I'm telling you, I appreciate it. Okay. you know, because I have a client, he had a sacroiliitis and he will never listen. He wants to play cricket. So he will go and play the cricket. He will tell, I am coming there, doctor.
For therapy. And then I'll go and
I told this is, you know, like, because, you know, like if we do the therapy, he become alright. He will tell that, you know, the moment I come to Shantigram, I'll feel better. He may be listening this program. Okay, so, you know, like he will come at least once in 3 months like that. Because now the weather is like this, he may not be playing. Otherwise, he will come. Yeah. Because see, again, they are getting, you know, like torn. Yeah, sacroiliitis means, you know, if you are overdoing the things, it will definitely happen. And if some days you extend your legs, you know, you just fall. You ask them, you had any accident or anything like that? No. Did you fall like your feet apart?
Correct.
Oh, then, oh, I had it. Because when we see the pulse, we see the tear. Yeah.
All right. So, so now we know that Ayurveda definitely can cure sacroiliitis.
Definitely.
Question comes to my mind, and as a matter of fact, one of our viewers has sent in this question, Ambikaji, that in this show, in this Ayurveda Mantra show, you always talk and you emphasize on vegetarian diet. So person wants to know, do I have to be a vegetarian to follow an Ayurvedic lifestyle?
Not at all. Okay. During the therapy, because that is a detoxification. Detoxification means, you know, like, because every cell in the body has to be, you know, cleaned and regenerated. At that time, there is no point in eating all the, you know, like stuff from there.
Okay.
So that's why, you know, because this is all, we are detoxifying. If we are putting toxin means, then there is no point in doing Panchakarma.
Correct. So that's your point is that during any therapy, any only treatment therapy, which is ongoing, that's when trying to be vegetarian as much as possible. Only
because once, you know, like you are regenerated, you know, we tell them, you know, like that's why I told about the sacroiliitis also. We tell them to take, you know, the diet will be always changed.
Absolutely. Yeah. If someone is just taking, let's say, herbal medicine, Ayurveda herbal medicine, which many kinds available at Sacroiliac, Kerala, do they have to be vegetarian while they are taking this herbal medicine?
Never like that. See, nobody will take an Ayurvedic medicine first of all just like that. Okay. Some people will take, they will tell that I take Arjuna. Okay, so they will be having little cholesterol issues, got it? Okay, even little breathing issues. So at that time, you know, if they have like this, then they should not take any, you know, yogurt.
Makes sense.
And very cold food.
Exactly.
And their, you know, especially they should not eat their dinner very late. So very simple things. So they should, if they follow means they can. We you know, if they any liver issue means, you know, if they are taking any Sacroiliitis or anything like that, even we get a lot of patients with the hemorrhage, you know, like a bleeding, you know, like IBS, all those things. So we tell them, you know, stop the chicken and the egg and all. Why? There is a reason for that. At that time, for a stipulated time, we tell them not to eat it.
Correct.
And some people, whole life, they cannot take all those things because it is better to stay healthy than to be, you know, like a diseased person, right?
So obviously you need to follow some, you know, strict regimen, and Ayurveda really offers
little bit.
Absolutely. Yeah. Thank you for clarifying that, and like to thank a viewer for sending that question. That was a very important question, and let's hope that it clears confusion. With that note, we almost come to an end of the show, but not before getting mantra from Dr. Ambika Nair.
We have very good oils available, so you can use any oil for the massage. Okay, that is very important actually. So that the stiffness of the joints will be better with that. But warm oil is not very cold. At least if you don't have any oil, buy some sesame oil and do it.
Sesame oil has a...
And for the sacroiliitis, turmeric is one of the important thing what you should take it.
Okay. Turmeric with warm water.
Warm water
in the morning.
And warm water
in the morning.
Another thing is that you can boil, because acidity is also one of the reasons. Okay?
Correct.
You can take 1 tablespoon of whole coriander seeds. Okay, boil it with like 4 glasses of water, and you can just cool it and take it. Not very cold, it should be warm, okay? So this will help a lot.
Okay, Ambikaji, thank you so much for that mantra of the day, and thank you for all your input and guidance and suggestion on Ayurveda. Sacroiliitis, that's what we came to know more on Sacroiliitis, what causes it and what is Sacroiliitis. And that's what this show, Ayurveda Mantra, is all about, that you get to know the benefits and importance of Ayurveda and the Panchakarma. And it's all courtesy of Shantigram Kerala Ayurveda Wellness Center, USA. I am Sanjeev Pandya. Until we meet again, same place, same time next week. Please take care of yourself and live a happy and healthy life. Good health is the most important thing. So long, take care.
Thank you.